present tonight is that we have three options. Clearly, this presentation tonight has more to do with masks than all of the other mitigation efforts that we will continue to do in the district. I like to use the term layered mitigation, that we have to continue to look at other layers of mitigation, not just the mask issue alone. And so if we relax other mitigation efforts along with the masking, how much of a concern might that become? So first option is optional masks, everybody. Students, staff, entire district. Next option, next slide. Vaccine availability it's only available for ages 12 and over, so option 2 says, all right then, if you're 12 years and older, 7th grade through senior year, it was your choice, it's your responsibility, you got vaccinated, you didn't, it was a choice there, it's your choice to wear a mask to school or not. However, grades PK through 6, they're not eligible for the vaccine, so a middle of the road option to consider is that that age group would continue to wear masks. Next slide, please. And of course, option 3 is require masks, all grades, PK through 12. Proactive measure, get ahead of the variant, don't let the variant, don't remove all of those layers of mitigation, don't let the variant come in here like a tidal wave, take that mitigation plan to require masks. So those are the three options. I wanted to present all of those thoughts kind of collectively again for the missing board members, for these board members, those listening at home. It helped me to kind of go through some of the things to help explain what are we pondering, what are we thinking about with all of this. And with that, I will give the mic back to you.
First of all, let's just see, do board members have any questions of clarification about the slides? We won't discuss them, but there would be a question of clarification.
Jamie, I wondered, am I on?
To the back.
I think you're on.
Okay, yep, definitely on. Jamie, I wanted to go back and ask about your slide that was talking about the increase in cases at 300%. And did I understand it correctly in that you were also citing that that hospitalizations are also up 300%? Can we flip back to that slide just so I want to make sure I understand what
I'll tell you what the source of the information came directly off of the website that I cited there. And I think it was a time span of a month that was referencing between June and July. Keep going back there.
Yeah, that one there. I just want to make sure I understood that that's what that.
That's nationally between June 19 and June 23. Overall, all states included,
Yep.
the entire nation. That's in accordance with what's on the CDC's website.
So it's saying COVID cases have increased nationally 300%, along with parallel increases in hospitalizations and deaths.
Yes.
So we're saying all three of those things are all up 300%, or it's just they're.
I got you.
Yeah.
No, I don't know that hospitalizations and deaths are up 300%. I do not know that. I personally, when I saw that, took that to mean simply the number of positive cases has increased exponentially 300%. Naturally, to no surprise to anybody probably in this room, so too would be the seriousness, hospitalizations, so too would be deaths,
Okay.
but not necessarily hospitalizations and deaths increasing at 300%.
Okay. Thank
I'm
you.
glad you asked, because
Yep.
that was definitely not my intent.
Thank you.
It says okay, so at this point,
Just,
oh,
Todd had a
I'm sorry.
question.
I can wait. What? Can you guys hear me? Let me steal your mic.
Yep.
Here, can I? Let me see that for a second. There you go. The question I had is, it doesn't need to be answered right this second, but there would be a number of implications beyond just the classroom environment, or what it means for things like extracurriculars and visitors and those kind of things. I'm curious to know that, but I'm not sure if it's appropriate to get into some of those things quite yet.
I think that's an implication, and right now we're talking about clarifications.
Okay.
Are there any other clarifications about the website, or the presentation?
Jamie, one thing I didn't see up here, I looked at a national site today, I didn't look at Pierce County's, the percent of people in Pierce County that are currently fully vaccinated. The site I looked at today, New York Times site said 36% in Pierce County.
Roughly 47.
Yeah, I read it's now slowly surpassed 45%. It's still less than 50. That includes ages 65 and older. The good news for that group is that they're at either 80 or 85% fully vaccinated.
Okay.
And so the vaccination rate is, as we all have heard, is certainly one of those things that people need to think about in helping to keep our children in school. It will presumably be impacted by the vaccination rate. That's just how the science is going to work. That's not an opinion.
But that 46% you're saying is fully vaccinated, and that was on the Pierce County Public Health?
Yep, Pierce County's website. Aaron, can you go to the last slide?
The other thing, Alan, that they have the link from AZ Snyder, you can stratify it by school district too. In River Falls, within Pierce County or within Pierce and St. Clair County, River Falls, I think it was just under 50 for full series and over 50 for at least one dose. So last I looked at it, which sometime yesterday.
Okay, at this point, the board welcomes public comment. I apologize for the mic problems today, but hopefully that mic is going to pick you up quite well. You're welcome to come to the microphone. Please tell us your name, the school or schools where your children attend, and I'm going to ask you to limit your comments to 2 minutes, please. Would anyone like to address the board? Could you please tell us your name and the schools the schools that you represent? I think I know.
I live in River Falls, in the River Falls School District. I do not have children in the school district anymore. Actually, my children went to Hudson. I just wanted to say that.
Could you tell us your name, please?
Oh, I'm sorry. Jackie Nick. And
Okay. So my name is, that is loud now, is Jackie Nickham, and I live here in the River Falls School District. And actually, my children had gone to the Hudson School District, but I'm really happy to see a lot more people here attending. I think this is really, really important. I'm not going to bore you with a whole lot of, I would disagree with a lot of the presentation. I find it, with all of the back and forth that the CDC has done, I find it difficult to believe what they're even telling us any longer. So I'm just going to read, this was a statement from Governor Kim Reynolds of Iowa. She put out this statement on July 27th, just a few days ago. She said, the Biden administration's new COVID-19 guidance telling fully vaccinated Iowans to now wear masks is not only counterproductive to our vaccination efforts, but also not grounded in reality or common sense. I'm concerned that this guidance will be used as a vehicle to mandate masks in states and schools across the country, something I do not support. That's just from one of a number of other governors who are not supporting the new mask guidance. Thank you.
My name is Kristen Miller. I have a second grader, an incoming second grader at Greenwood, and I just want to thank you guys so much for the opportunity for us to come forward and speak tonight and hear our opinions and thoughts on things. I just really want to urge you as school board members to protect our children and to follow these guidelines that are put out by the Centers for Disease Control and the American Academy of Pediatrics that Jamie had mentioned earlier. And really, I encourage masks for all kids ages 2 and up. This is science-based recommendations, and these are leading experts across our country. I liken the mask recommendations to the guidance provided by the AAP for children to ride in car seats or boosters. We wouldn't go against these recommendations because we think we know better. We trust their expertise and put our children in car seats because we know it's best practice and saves lives, similar to the recommendation for our children to wear masks. I'm not a public health expert, nor am I an epidemiologist, and I don't believe any of you are either, so let's defer to the experts who are and have our students' best interests at heart to keep safe. I understand that parents have concerns about masks. I get it. The guidance is continually changing from the Centers for Disease Control, and I agree that brings about concern. But we need to remember that that's science, and science is an ever-changing thing. And when we know more, we learn more, and we do better. I know there's also concerns about the mental health aspect of children wearing masks in our school. And from my opinion, the mental health concern comes more from COVID-19 pandemic in itself, more of the lack of routine that our students have, the inability to socialize, not from the masks itself. My daughter had the opportunity last year to attend virtual school within the district, and that clearly showed me that you don't need to be in person or without a mask in order to connect with our students. Her teacher did a wonderful job of connecting with her, and Emma's so excited to be able to hopefully go back to school in person and have her again this next year as well. I just want to thank you again for taking the time, and I guess I just really want to encourage you to follow the guidance of these experts that we're so lucky in our country to have and the science that they have. And I ask you to please consider protecting not only my child, but the other children within our district, and I encourage you to be proactive about this. Thank you.
I have a big voice, so I want to make sure that I don't cause any damage. Does that sound okay? All right. I also want to thank you all for the job that you did last year.
Excuse me, could you please tell us your name and where your children attend?
Yeah, my name is Phil Fahey. I have a son that's entering first grade at Greenwood. As I was saying, unprecedented times, a lot of confusion. You guys did the best job you possibly could at managing your way through a situation that, people really didn't know what was going on. Fortunately, though, as the speaker right before me had said, we do have some experts that are out there. And I wanted to bring with me tonight some statements that were made by Paul Alexander. Paul Alexander received a bachelor's degree in epidemiology from McMaster University in Hamilton, a master's degree from Oxford, and then he went on to receive his PhD from McMaster University's Department of Health, Research Methods, Evidence, and Impact. I'm gonna try to be super brief, okay? So I'm gonna not read this whole thing. You're probably looking at these pieces of paper, getting kind of nervous. I'm not gonna, all right? You can find this article on your own, or I'd be happy to send it to you. How did this blue surgical mask and white cloth mask come to dominate our daily lives? Indeed, the surgical masks and white cloth that are often homemade have become the most contentious and quarrelsome symbol and a reminder of our battle with SARS-CoV-2 and the disease it causes, COVID-19. How dangerous is this virus and the Delta variant? Based on studies done by Professor John Leonidas at Stanford, we know we're dealing with a virus that has an infection fatality rate of 0.05 in persons 70 years old and under. This compares quite well with the IFR of most influenza viruses, and yet the draconian and massive reactions to COVID have never been employed during the flu season. In an emphasis of time, I'm going to jump to the final point that I'd like to make. I know y'all want to get home. There's a lot of research that supports that these masks just don't work. Fauci himself came out and said it on 60 Minutes. As a matter of fact, one of the leading doctors came out and said that a cloth mask is not effective after 20 minutes of use. Now, when my son was at school, he'd come home, that thing would be soaked. All right, so he's sitting in front of his friends, he's talking to them, he's blowing droplets all over. The Delta variant's real, okay? But it largely doesn't affect kids. They don't have the ACE2 receptors in their noses. We get it, not little kids. There's really two things that I've heard from people in this community when it comes to school, and really not in this community. I deal with a lot of people throughout the United States. Number one, we want to keep our teachers safe. My employer required me to get vaccinated. Let's do the same for our teachers and the staff in this school and keep them safe. The other concern that I've heard from people is our children are going to go to the school, they're going to pick up this disease, and they're going to bring it to their grandparents who may be compromised. We'll handle that as parents. That's my job to manage. So if I want to bring my children around their grandparents after they've been at school unmasked, that's my right to do that. So in closing, I'm going to say what Paul had to say. Masking children is an absurd, illogical, nonsensical, and potentially dangerous as trying to stop every COVID case or stopping COVID at all costs. It's never going to happen. There will be more variants. Ironically, I wonder what happened to Alpha, Beta, and Gamma. We jumped right to Delta. It's bizarre, okay? Masks are not needed in children because there is near zero risk for children. The risk of dying from COVID-19 is almost zero for young people. The issue of masks in children is really a risk management question for parents and any decision maker, and the science has settled it. Thanks.
My name is Steve Schrader. I'm obviously too old to have children in this district, but until pandemic, I tutored almost 100 children in this district at Meyer and Westside, and I miss them very, very much. Jamie, thank you very much for this evening. I wish you would back up to the slide that the American Academy of Pediatrics had relative to why the children should be masked. Not an individual opinion, but the American Academy of Pediatrics. Thank you.
Just FYI, the AAP, their #1 donor is Pfizer. Just keep that in mind. My name is Jill Ewald Chain. And I might have a child entering kindergarten, depending on what you guys decide.
I apologize. Okay. Steve, what did you want?
I asked Jamie to respond to that slide.
I guess I didn't understand that you were asking for Jamie to respond. I thought you wanted it to be back up there.
Well, I would say one reason why we are presenting these three options tonight and the board is discussing it and hearing comments from the community is that, as I tried to display in the slides, I can tell this story in a way that points you to current COVID data and suggest that it might be okay for us to just have it be optional. Then when I go over to people that know more about the medical side of this and the science side of this, people that are experts in areas that I'm not, the question is, how do we weigh in their thinking with where we're currently at with COVID numbers in our part of this state? So how's that for tiptoeing around the answer? I don't know, but I wouldn't have put it on the slide if I didn't think it was very relevant information that should be considered by everybody in this room. I didn't say it had to be the number one overriding factor, but in my mind, we would be terribly remiss as educators to not try to educate ourselves on what the experts in the field are telling us.
Okay, ma'am, you may start, and I'm sorry, but I missed your name. Could you please tell us your name again and
Jill
your...
Ewald Shane.
Jill?
All right, thank you for the medical freedom this summer in terms of mask wearing. I hope you can implement mask choice for the fall as well. Let families make these medical choices for themselves. In Wisconsin, we have 3 exemptions for vaccines. Masking exemptions should be no different, as they are considered medical devices. We've always had different illnesses come through schools and a varied background of vaccine status. We've never treated anyone as being sick by masking and quarantining them just because of a close contact. This overreach has to end. I do not and will not co-parent with the school board, health department, county, state, CDC, or any form of government or organization. Only my husband and I get to decide what's best for our child. We, the parents, will applaud and support schools and school boards that support and respect a parent's right to choose. Please do the right thing in making masks a parent's choice. Please make them optional.
Would anyone else like... Oh, I see someone coming.
Hello, my name is Teresa Cohen, and I have 4 children. We're planning to send our 2 oldest boys to West Side for the coming year. They'll be in 1st and 3rd grade, after we did virtual school last year. Both of my boys have an incredible need for in-person learning this year, especially one of my sons. Though we we thought the virtual school was a great fit for us last year, we began to worry about the son's mental health. After he told us more than once that he no longer felt that he was a part of this world. The precautions put in place last year ensured that kids stayed in school and that cases were well managed. After last year, we began to feel more comfortable with the idea of sending our boys back to in-person learning. The Delta variant, rising cases, and now news that masks may not be required this year have thrown our plans into question for us again. As of July, 335 kids in the U.S. have died of COVID, but 0 are dead from wearing a mask. Unless your child has a severe developmental delay, there is proven to be no harm in children wearing masks, no medical harm. My husband and I are vaccinated, but we've gone back to wearing masks in indoor public spaces due to the low vaccination rates in our area and the increased severity of the Delta variant, because we do not want to risk spreading COVID to our children and others in our community. Our family has made sacrifices to try to lessen the load of children physically in schools in the past year. A loud minority have been calling for the freedom to not mask, but that takes away our freedom to send our children to school in a safe environment. If some families are upset about mask requirements in school, then they absolutely can take advantage of virtual school this year. It's time again, with cases on the rise, for everyone to do their part to keep our unvaccinated children safe, because they undoubtedly still need protecting. Not requiring masks would be letting down every parent and child in this community, whether they realize or acknowledge it or not. I implore you to make masks a requirement for the upcoming school year for the safety of our children and our community. Thank you.
My name is Barb Colpine, and let's see, I had 4 children go through the school district. As Steve said, obviously I'm too old to have my own children in the school district. I do have a granddaughter who has gone to the Montessori and West Side. And so I speak, but I speak as a former school board member, and I swore I wasn't going to say anything tonight. I was just going to listen, and I have been listening. So I had to make a couple comments. And the first is that masks are not medical devices. I made drugs and medical devices as a professional engineer for 15 years, actually 25 years, if you count the masks and the infection prevention. Masks are not medical devices, so don't think they are. You know, a respirator is, but, you know, I just wanted to make that point. There is a difference. Masks, the ones that you sew yourself, that you buy at Holiday, are not regulated by either NIOSH or the FDA. So they're a whole different animal, and they don't provide as much protection as a respirator does. And the other comment I wanted to make is, I understand full well how hard your decisions are, and I totally respect and have my own sleepless nights thinking about the hard decisions that you guys have to make. So I do honor that. But when you're looking at statistics, statistics can lie. Again, probably Steve has done more on statistics than I have, but other than Steve, I've probably spent more time manipulating numbers, looking at the data, trying to analyze it and figure it out than just about anybody here. And if we allow ourselves just to say, what is Pierce County, what's happening in Pierce County today? We're forgetting even St. Croix County. If we say 47% of the people are vaccinated, if you look down a line on the data, you know, it might say like everybody 16 and above is 47%. And that includes the 87% of the people. But then you start, this is a school term, disaggregating the data. Then you'll see that maybe only 30% or between 30 and 40% of the 12 to 16-year-olds are vaccinated in this state and in the county. And so be careful when you're actually quoting absolute numbers, because they're not absolute. And then also be mindful of the fact that if your child is sitting in school, the child sitting next to them maybe was in a wrestling tournament in Savage, Minnesota last weekend. And there have been outbreaks there. They are in a high transmission, they're extremely high transmission area. Those kids are not locked into the county. They get to travel. They can go to Target in Woodbury. They can go wherever. The kid sitting to the left of your child in school could have just come back from Disney World and interacted or been exposed to kids from Brazil, from wherever, around the whole world, and sat on a plane. So statistics, I know you have to pick a number to use and a number to make decisions by, but be mindful that numbers that are too simplistic will lie to you and will not, so they might give you a false sense of comfort. So just be mindful of that. And I know it's a horrible, hard decision to make, and I respect the work that goes into it.
Do we have anyone else who would like to address the school board? Please come forward.
Hi, I'm Patsy Warwheat, and I have 4 kids at the Montessori. They attended virtual until mid-March last year. And we're very grateful to go back, and would not have gone back if the masking mandate was not in place. I actually pulled them out of summer school, and I know quite a few other parents who did as well, because it's not just a parent making a choice for children. If you take away the mask mandate, you're allowing everyone else's parents
to make choices for my children. And my children have underlying conditions for which COVID could be really not so great. And I know that they're not the only ones in the district, obviously. And I would hope that you all will consider the kids that have had to be home because they were uncomfortable with the what ifs. Their parents were uncomfortable with the what ifs of last year, often because of health concerns. And the kids that have really suffered from not being able to be with their peers for a good part of the last year and a half, and how great it was for the students and the staff who were able to be in person, though they were masking. There was a lot of learning going on, there was a lot of growth going on, there was a lot of good, positive mental health. And I fear that if you choose to ignore the science, especially about the Delta variant, which has obviously changed the game. We're not sitting here in December. We're not sitting here last year in June, July, August. It's a completely different wave that's coming, and if we go into it without a mask mandate, there's a great potential for the wave and the effect to be considerably worse than what we all endured last year. My kids, all 4 of them, need to go to school. They need to go to school not only for their academic learning, which has greatly suffered over the last almost year and a half, but certainly for their mental health. I have a 6-year-old who does not want to live if she doesn't get to go to school and see friends and do normal things for a 6-year-old and feed her brain. And she won't be able to do that because of her medical conditions and the other medical conditions in our family if the other kids are not masked. If you take away the masking mandate, what are you going to do? How are you going to enforce that? Are you going to have a list on the wall for the teachers so that they know which parents have said, my child can be masked, my child cannot be masked? Because I'll tell you what, my 6-year-old is going to take her mask off when everyone else's children are doing it and saying, oh, nobody has to be masked. But it's not safe for her. And frankly, I believe it's helping our kids to understand that they can be good community members. And I would hope that we would be good and thoughtful and considerate community members to the rest of the community, including the kids in the school and the families around. Please, please require masks, especially, and I can't believe we're even discussing it, for the kids under 12 who do not have an opportunity to be fully vaccinated yet and will not certainly by the beginning of school.
Hello, I'm Shalyn Nygaard. I am a graduate of River Falls, and my oldest child is a graduate of RFHS and UWRF. I have an 11-year-old and an 8-year-old that were both virtual the last year and a half, but were in Westside prior to that. I don't think I'm a COVID expert, but I do have a bachelor's degree in chemistry and biology. I worked for 2 pharmaceutical companies in Seattle, one of which created Tamiflu. So I had training in pandemic preparedness even before COVID was a thing. I get all of my information from reading scientific studies and listening to only the leading experts in areas such as infectious disease. Studies have shown this recent Delta variant to have a viral load 1,000 times higher than previous variants, regardless of if you're vaccinated or not. This means that infected people are contagious earlier and for a longer period of time. This also means that, unlike previous variants, vaccinated people are potentially just as likely to pass COVID on to other people. Yes, vaccinated people are much less likely to get COVID themselves, so getting vaccinated protects you. But as Jamie said, only those over the age of 12 can be vaccinated by the time school starts. What about those under 12? We as parents have no ability to vaccinate our children in this age group. My guess is that probably about 25% of middle schoolers and 100% of elementary students fall into this age group of not having the ability to be vaccinated. Our only ability to protect these hundreds of children is through things like masking. As someone that lives with chronic illness, it is not just about the death rate. COVID can cause long-term health risks, long-term health effects like chronic fatigue, which is not fun to deal with. COVID can overwhelm the health system, as we've seen even in our area. People that I know that got COVID last year, they had to go to La Crosse to be in a hospital because there was nowhere closer to River Falls. Nowhere in the cities had any beds available. They had to go to La Crosse to be in the hospital. Science is messy. I've seen this firsthand with being a scientist. We learn as scientists. We adapt. We are literally watching science happen in real time, and that's why it feels like everything's changing and the CDC doesn't know what they're talking about. But no, it's because scientists are doing their job. They're learning, they're researching, we're finding out how does this transmit? How do people catch it? How can we treat people? This is all happening before our eyes. For those parents or families that are strongly opposed to mask wearing, as I know, the district offers virtual schooling. For working parents, the state is offering subsidies for virtual school children to attend childcare so that parents can still work. I've spoken with numerous parents whose children have been in virtual school for the last 1.5 years and who are ready for their children to be back in school with their peers. They've missed out on a lot. But only if masks or only if CDC guidelines are followed. Nobody likes masks. We didn't wake up one day and be like, God, I really want to wear a mask today. Nobody likes it, but we know that we can trust the experts, and the experts say that masking is necessary at this time. And we just, I think it would be a different ball game, I guess, if kids of all ages were able to be vaccinated at this point, and they can't. So I urge you to consider all of that. Thank you.
Hi, my name is Lisa Christensen, and I have 2 children going into the school, one going into high school and one going into middle school. And I'm here tonight on behalf of my kids. I want to ask you to stay the course and continue with your optional masks for the new school year. Please let families decide if they want their children to wear masks or not, and please let their children have the right to breathe air again, please. And here are some points for you to consider. On July 21st, 2021, the CDC came out with a lab alert and will be withdrawing the use of the real-time RT-PCR diagnostic panel to test for COVID-19. They state that the test cannot tell the difference between the flu and COVID-19. This makes me wonder if there really is a pandemic, honestly. This makes me furious. You're telling me that all of these tests, all these PCR tests, were faulty and we can't believe it? Why are they waiting till December 31st to stop using these PCR tests? Just something to consider. Another thing to consider is that there's also, with this CDC trying to justify their new mask guidance, they used a study from India that failed peer review. This study was a study on a vaccine that isn't even approved in the United States. I've emailed everybody on the board some of the articles that I'm referring to so you can read up on them. Obviously, I can't get into them because I only have so much time, but at least you can take a look and see what you think. Another reason why I believe we should make the masks optional is because, and this is for everybody in the community, not just the kids going to school, we have 3 vaccines. We also have other drugs or therapeutics like ivermectin and hydroxychloroquine that nobody talks about because it's been suppressed. These are possible cures for COVID-19 so that people don't get sick and don't end up in the hospital. I also believe that we need to teach our children, instead of masks, social distancing, use hand sanitizer, which is that even really that great for you, using those chemicals for your kids? Let's teach them to be healthier. Let's teach them how to improve their immune system. These are just thoughts that I had as well. I think that we should keep the mask mandates optional, keep the masks optional for the next school year. I think we should this isn't even talked about, but I just wanted to say from the last board meeting a couple weeks ago, let's keep the testing for COVID out of our schools. Let's also cease any future COVID-19 vaccination clinics out of our school district as well. They don't belong in our school district, on our school properties. I please just let our children smile at each other, let them get smiles back from their teachers, and just let them breathe fresh air, please. Thank you very much for your time.
Would anyone else like to address the board? We're trying to keep comments to under 2 minutes, please.
Hello. I'm short, obviously. If I tilt
Sorry.
it down, I think it's going to fall.
I can hear you. That's
Okay,
the good
thank
news.
you. You're the main one I wanted to talk to. My name is Heather Lane. I have a child at Westside and another child about to go into 4K. I'd like to thank you, the board, the community, for coming and sharing your thoughts tonight, and also to Superintendent Benson. I'd like to thank you all for your hard work this year and for letting us have this opportunity to speak. I care very much about the safety and education of my children, and I am incredibly proud of the River Falls School District and all of the work you did last year in your success in preventing the spread of COVID in the schools. I recognize that some spread happened. I did read Superintendent Benson's emails pretty much every week and checked what those numbers were, especially at Westside. And there was some spread, but it was limited. One of the spread happened in my son's class. Half of the class was out for 2 weeks on quarantine due to a close contact. After talking to the parents that were also affected, it sounded like it didn't spread at all, and I saw that as a huge success, that mitigation was in place and that children didn't get sick from it. That 2 weeks of virtual school was very difficult, and I applaud all of the parents, all of you that put up with that. You're a lot stronger than I am. Good job. But I would like to talk to you, I would like to encourage you to repeat those successes of last year in this upcoming school year by following the advice of the experts and looking on your successes and applying that to this year as well. A Wall Street Journal article from February said that COVID spread in schools is much lower when the students wear masks. And then it cited a CDC study on schools here in Wisconsin. So there's some great information that's pretty local to us. The CDC director said, "We know that most clusters in the school setting have occurred when there are breaches in mask wearing." And in the past month, the American of Pediatrics also recommended that everyone over 2 wear a mask at school, per the information that Superintendent Benson shared with us. One of the members of the American Academy of Pediatric Council on Student Health, Dr. Sarah Bodie, said, "There are many children and others who cannot be vaccinated. This is why it's important to use every tool in our toolkit to safeguard our children from COVID-19. Universal masking is one of those tools, and it has been proven effective in protecting people against other respiratory diseases as well." Did my mic cut out? There we go. And I can say, I have my son, he's in kids club. Masking's optional there. Every day we leave him there with a mask. Every day when I come home to pick him up, it's not on. I know that optional doesn't work because we are experiencing it. In addition to his time at kids club, only this summer, he's missed about a week and a half of class that we've paid for because he's been sick, because he's contracted respiratory illnesses, most likely there. It's our only vector in. Whereas during the school year, other than the 2-week quarantine, he only missed 3 days. So that also tells me that there's something there in the masking. I mean, granted, we're an in-size of 1, but it's still something that happened to us and something that's personal. So I'd like to close with that. We've seen success with masking in our own school district, and the experts are asking for everyone to wear masks in school. We should follow the advice of science, follow the data, and listen to the experts to keep our children safe and educated this school year. Thank you.
Hi guys, my name's Amber Morgan and I'm a pediatrician here in River Falls. Jamie called me today to ask about this, and so I actually felt compelled that I needed to come down and just tell you guys kind of straight up, we really recommend that we keep the masks. I would agree with all of the other folks in the room who have talked about your successes this last year. Our mission statement is to provide a safe environment for all students, and I really think masking is the way to do that. I have 2 children, but I have a patient panel of over 1,000 people in our community, and because I'm a pediatrician, most of them attend your school district. So please continue with your successes and wear the masks.
Good evening. My name is Nathan Seiko, and I have a child going into 1st grade at Rocky Branch Elementary. I didn't plan on saying something tonight, but I just wanted to make one comment or bring it up that I'd really like to see a survey sent out to parents just to get a general idea on everyone's opinion on this. Obviously, a handful of people that come here can have a wide range of views, so I'm on the side of I would like to keep masks optional, but it would help me to know, if it's 80% of people that want to keep masks, that would help me see that point of view. But the other question I would have would be, this summer in summer school, were there outbreaks? How did everything go? I mean, yes, there's some sickness that goes around. To me, that's natural. That happens with kids. Let me see if I have anything else I have here. Like I said, this is very off the cuff. Yeah, that's really all I have. Thank you.
I see nobody moving toward the mic, so I'm going to assume everybody who has had a chance, who wanted to speak, has had a chance. Okay, so we're a smaller size board. Even though Bob is here, it's a bit complicated for us to have conversation. I think that this is a night for us mostly to be able to absorb what people have said and to be able to get a shape of what the potential options are. But I welcome board members now to have some conversation among ourselves and with our superintendent.
Yeah, I can make a few comments. I didn't do a straw poll and keep track of the comments that were made tonight, but I'm going to say roughly 50-50. I did track the most recent, probably 50 emails that we've received, and it wasn't exactly 50-50, but in regard to a survey, I'm going to say it seems to be, I would say it's within 10 to 15% based on the comments and feedback that we receive and the people that I've reached out to within the community. So I don't have that exact information, but it would be great to know. It's still not going to solve, unfortunately, some of the cases that were shared here tonight on either side of that. If those people fall in a 1% or a 5% minority, it's still going to leave them on either side of things kind of left out to dry there. So my personal preference going into the summer was to do mass optional all the way through, and I think I haven't seen a whole lot of reason to change that. It's starting to, I thought things went pretty smooth this summer. I haven't heard of anything that tells me otherwise in regard to our district. Some of the things are getting a little bit harder to overlook or to just kind of keep the focus on our district and the numbers that we're seeing, because it has been very positive from all indications I've had up to this point. So my initial preference, I think at this point, would still be to stay with that course. I think my second preference would be to look at option number 2 and that Jamie presented, but I wouldn't be totally against us going with mass either. So I don't know where the middle ground is. I think if I had to vote on it today, I'd probably still be in the camp of option 1, maybe option 2 as a fallback for myself. And I should say that too. I do have, not attending summer school, but I do have a child who's attended Kids Club all year. And so I've been in the building, experienced that, and had a chance to get a little bit of feedback from that perspective too.
I don't know where I sit on this right now. Well, no, I shouldn't say I don't know where I sit. I think this is very complicated. This is very complicated, and I appreciate the fact that we're having this information tonight, Jamie, and taking the public comment in. We've gotten lots of comments via email and other ways, and I'm sure it's going to continue. This, just like a year ago when we were deciding on what we were going to do in the fall. And as a board, the one thing we could agree on is the fact that whatever we decided was not going to be universally popular, and that all of our options were not what we would choose if we could. That we had hard choices to make last fall, and we didn't like any of them, but we had to choose a course and go with it, and we're faced here again. So I'm anxious to see where we are next week. I'm anxious to see the 3 board members who aren't here tonight. I'm anxious to listen to their conversation, and we need to sort of shake this out a little bit more and hear what everybody has got to say, because we've got to come to some agreement on what our policy is going to be on the fall. The one observation I have about this, I just haven't, I've been thinking about this for the last few days, that a year ago, where we were a year ago, and the conversations we were having as a board, the conversations we were having as a community, the conversations we were having nationally were the only way we're going to get out of this is if we can get a vaccine soon. And the efforts to get the vaccine, and we were all anxious about the vaccine. How soon is the vaccine going to come? And I got to credit President Trump for this, and some of the leaders out there really moved this through and came up with some options for us for vaccines by December. And we were so anxious about it. President Trump and his family were among the first to get vaccinated. All the former presidents got vaccinated. Everybody was just all excited about being vaccinated. And the rate of vaccination was very high up until about the end of April, early May. Free vaccinations available to everybody. Who would have thought a year ago when we were all so desperate for something, that here we would be all these months later, a year later in thinking about it, 8 months after the development and the rollout of the free vaccine, that we would have less than 50% of the people in this county fully vaccinated. And if you would have told me that a year ago, I wouldn't have believed it. I wouldn't have believed it. And quite frankly, if right now we are at where we assumed we would be a year ago, we wouldn't be having this conversation. The reason we're talking about masks tonight is that less than 50% of the population in both these counties, okay, and regionally, there's only a few spots that are really a lot better than what we are right now. And as a result, the virus continues to grow and mutate and all of that. So we can't fix what hasn't happened, but I just think that that's an observation, that people's individual choice to not get vaccinated, and I respect that. Everybody's got their choice about it, has implications for the community. And one of the implications for that is what we're talking about tonight and what we'll be talking about next Monday night. So.
So I would just like to thank everybody who came tonight and had the courage to stand up and share your opinions and your thoughts. I also have received lots of emails over the past week or so, and I would just encourage anybody who's tuning in via live stream, please continue to share with us where you're at on this. I'm new to this ball game. I was just appointed last month, but I can say with certainty that one of the great things about our board is that we really represent a variety of backgrounds and perspectives, and my impression thus far is that we all are trying to recognize and understand that there are a variety of opinions that are held by the people in our community. We want to respect that, and we want to understand where everyone is coming from. The point of this was to offer some transparency to the community and to help you understand the unique situation that we're in. This is a very difficult situation. I also was in favor of optional masking in the summer. I have 4 young kids. I've watched the pediatric data since the start of COVID. That appears to be the one thing that has not significantly changed. That has kind of been the one constant throughout this whole thing, and I do take comfort in that. My kids are not yet eligible for vaccination, and in my mind, I am thinking about those kiddos, particularly pre-K through 6th grade, who are not eligible for the vaccine if that was something their family chose for them. I'm looking at some of the social, emotional, and academic implications that come from masking. And so that's something that is weighing on me, and I'm trying to balance that against the risk of serious illness. It's low, fortunately, at this point for the majority of our kids. This will not be an easy decision for any of us, but I just really encourage you all to continue sharing your feedback and your thoughts and your perspectives with us. So thank you.
I'm the last one here, so it's my turn. I've been doing a lot of homework. I'm not a scientist, and so I am not able to evaluate scientific articles or findings, but I do have some background reading educational journals and articles and research. So what I did is I started looking up Harvard and Stanford and Northwestern universities to determine what their scientists were looking at, particularly related to the social and emotional impacts of COVID on kids. And one of the things that I am reading very consistently is that scientists are finding, researchers are finding, that virtual learning has been very difficult for kids socially and emotionally. That, I think, is going to be an extraordinarily strong guiding principle for me as I cast my vote. I want to protect in-person learning because I think that it is in the social, emotional, and academic best interests of our students. Exactly how this all works out is left to be determined, but that is what I will be keeping in my mind.
I didn't want to jump in if you weren't done. So I was going to add a few more things. One that you just touched on. we haven't surveyed the board or the administration, but I think the one thing that I observed being different from where we were last year is talking about a learning environment versus, all in person, hybrid at different grade levels, and or all at home learning. I don't hear that conversation. I don't think that's on the table at this point. But if something that would probably change or sway my opinion in regard to mass is if there's something that tells me the kids that we're having to exclude for close contacts last year became a problem. If those types of things aren't having to happen, if masks are involved, I probably feel a little bit differently than I would when we looked at it for summer school. The other part would be is if it means preventing some sort of shift in the learning environment. I'm going to be in favor of going to mass as a first option across the board before I would be in favor of excluding additional kids from class, close contact quarantine. If we can find ways to eliminate some of those other things that became big problems for us, I view the mass as if the mass are a way to do that, it probably changes my opinion on where I stand there.
I agree, Todd. I think that, we heard repeatedly many significant stories of how the close contact quarantine was really difficult on kids. And if we can prevent that, we are supporting them academically and we are protecting their social emotional well-being. So
I know it's too simple to say it this way, but if you told me that no kid would be excluded from being too close to a positive case throughout the year because there were masks on, I would say put masks on and don't even think about it. But I don't know the reality or how likely we are to achieve something like that just by adding the mask. I don't think it's quite that simple, unfortunately.
I wish that we had 100% guarantees on everything. I think we don't, but I think that we can find some preponderance of the evidence.
Can you help me just provide a little bit of background, because I was not sitting on this stage however long ago, back in August, when you were making these very important decisions. Can you remind me what the recommendation was from the CDC in August when you were trying to determine how to make school happen as far as in-person, virtual? What was the recommendation at that time? Do you all remember?
I think I'm correct in saying it was a 6-foot rule, even if you're wearing a mask. If you're within 6 feet of a person who tested positive, you're considered a close contact. Therefore, you will be quarantined under what used to be a 14-day rule. Then they changed it to a 10-day rule that you could reduce to 7 days if you tested negative. And so they did move off of that 14-day rule, but it was originally the 6-foot rule and so on. Then when it changed down to...
I'm asking actually, yeah.
The school environment.
The school environment. What was the CDC and the AAP, forgive me, the acronym, what was the recommendation at the time? Because I think something that I'm mindful of is that the implications of virtual school or learning at home, I think not everybody fully understood the ramifications of that and the impact that it would have on social, emotional, and academic development. And so I'm just trying to look into the future and go, what are we going to look back on and question or wonder if that was the right choice? And so that's what I'm trying to understand. Certainly the board made the decision to veer from some recommendations from public health. And so I'm just trying to get a sense of, in the previous decisions you have made, what gave you the sense that it was appropriate to go against the recommendations, if that makes sense?
I don't recall there being discussion about a universal CDC, or I don't even remember hearing the term AAP up until the last couple weeks or month or two. And so I don't remember there being a universal. It was kind of, Wisconsin made a decision as a state in March of 2020. That ran through the year, and then it was kind of figure it out locally with that's how I remember it. But I'll be honest, a year and a half or a year ago feels like 3 lifetime,
Eternity
yeah,
almost,
yeah.
doesn't
So,
it? Oh.
but I don't remember there being a defined guideline, CDC, because the mask mandates weren't happening even at like the state level until around the time we were having these conversations, like roughly July, August of last year. And we were already kind of down the road of making some of these decisions. So I don't even remember being part of the discussion because it was more, the state has pulled back. There's not going to be a universal requirement across the state. Figure it out locally is how I remember it being. But
So just to clarify, there was no recommendation from the CDC to keep kids home, that kids should stay home in the fall of last year? Okay.
Not a direct answer to your question, but I will say in the last few months, I personally, from following some of these experts, I think that there's a growing set of consensus that one of the learning lessons that we have from the last year and a third that we've dealt with COVID is the social emotional impact on kids of not being in school. The evidence related to masks having a profound negative impact on students' livelihood, academic progress, and so on. I think from what I know from what I've seen is a little less. Point is this, the CDC, other experts are agreeing we need to get the kids in school, where previously their message was, hang on a second, you got to watch out for the COVID cases in your area. You might be wise to follow this Harvard model. When it shifts over to yellow and goes to orange, you better shut her down. You better send people home. And, you know, we purposefully did not commit ourselves as a district to any magical formula. We debated it. We talked about it. We, behind the scenes, were collecting data on the number of total close contacts, the number of positive cases. We had a grid that we made kind of our homemade matrix, and we were monitoring it, but we didn't want to make that commitment that we were lockstep to some new number that was going to control the day. But I'm reminded all of this when you ask those questions, that one of my slides on here, I had that Harvard model on there and said, the reason I'm putting this on here is because some people are asking for, maybe we should have a number that says if you're going to pivot from something, whether it's no masks, optional masks, or whatever, what's going to be that lever? What's going to be that trip that's going to cause that? Frankly, we've been reluctant to commit ourselves to an actual mathematical formula, but some would argue maybe that kind of formula, some would see it less nebulous, perhaps, more objective than subjective. We haven't landed on that formula for tonight either, but I'm curious to hear if the board would like to see that become a part of the proposal that is put in front of you a week from tonight.
If, just to kind of respond to Lindsay there, we used guidelines from Pierce County and the national CDC, but most school districts were left to figure this out pretty much, and that's kind of how we went through this. So what drove, when were we following Pierce County's 100%, when weren't we? That was part of discussion. And this is an evolutionary process, and this board works really good at sort of talking through stuff, and so we all kind of understand what each other is saying, so we can come to some kind of agreement. There's part of me that says, I envy the certainty that a number of people who have talked to us tonight and sent us email can have, okay? That's a luxury that us as board members don't always have if we're gonna follow our responsibility as board members. That we need to listen, and we need to tune in, and we need to really pay attention, and we can't just make up our mind and come in, okay? I don't think that's a responsible position. So we have to continue to talk through this and figure it out. Like I say, we've got 3 other board members here who we need to hear about. I would say another comment as I've thought about this too. So what are these factors? I mentioned one earlier about the vaccines. Another is In my time on the board, we've had a number of issues about student safety that we have dealt with. And when there was a lot of concern, I'll put it that way, about active shooters in buildings, and that was there was almost an epidemic of that going across the country. And what were we doing as individual school districts, and what was our district doing to mitigate some of those things? There were times when I began to wonder, maybe we're going too far in some of the things we did. We did a lot. We spent a lot of money on our buildings to make them more secure in many, many ways. These buildings are not like they were 15 years ago at all in the way in which we deal with our students. And often I heard people saying, questioning the cost or questioning the procedures or what we were doing, and gee, now people have to check into the office more carefully and all these kinds of things. Have you ever had a problem with this? No. We'd never had a problem with this. Have you ever had an active shooter? No. Okay. That doesn't mean we didn't do these kinds of things to prevent. So, point being, where I'm going with this comment is, as a board, our goal has always been to prevent disaster, prevent episodes that put students in crisis safety-wise, rather than to say, well, let's wait till somebody dies, or let's wait till somebody has a severe reaction, or we have a severe outbreak, and then we're going to do something about it. That wouldn't be this board's response to it. But I think that needs to be behind what we're doing. Just because something hasn't happened doesn't necessarily mean it won't. I'm using that logic because I'm stating that logic because that's the logic we've used on every other safety issue that this board has dealt with. What our mitigation is going forward on this particular one, I'm not quite sure yet. It's something we got to decide probably by next week. But I would just lay that out there, that just because stuff hasn't happened doesn't mean it won't. And I would say, quite frankly, the reason that summer went so well this year is because of all the mitigation efforts we did this last year. I can't help but think that didn't put us in a much better situation this summer than we would have had if we hadn't done that. So.
One of the questions that Jamie asked us is if we were interested in a threshold, or what an indicator, is that the word that you asked? And so I'll respond to that. Yes, my answer is yes. Exactly what that would be, and if it's even possible to think of a magic number or what a threshold would be, I don't know. But the reason I say yes, I think we have to have that conversation, is my assumption is that when we make a decision next week, we're not making a decision for the next 9 months, because I think the reality is going to change enough that we will need to come back and revisit it. Exactly what will trip having it on the agenda to revisit it again, I don't know exactly, but sometimes the awareness that it needs to come back is what we need too. And so in the absence of a magic number, maybe there would be some other ways of thinking about when we would come back. So I'm voting yes. I just don't know about a threshold. I just don't know exactly how we would accomplish it.
Put your mic.
Bob, just 1 second. We're going to put another mic by you.
Board member Bob Casey is joining by telephone, and we want to see if we can have him be heard a little better.
Okay, start again, Bob.
You mentioned the desire to have a matrix, and I think that's a really good idea to take a look at. Obviously, positive tests, any outbreaks, and that type of thing, but also vaccination rates. These types of things would be important to lay in anyway.
So I think, Bob, if I heard much of it about perhaps a matrix would be one way of going, that we would have a variety of measures within the matrix, including vaccination rate. I don't think I caught the other things that you would include in the vaccination in the matrix.
Yeah, I would look at, I see it happening this year very similar to last, in that I'd also like to add the component of a matrix. The matrix, I think, would be looking at the similar things to looked at before, positivity rates, and hospitalization rates and the things last year, but also vaccination rates and then outbreaks inside our people. I would like, like every board member wanting to do anything, and if it's for those kids school for 5 days a week, however we can do that, however we can do is I think a common goal here.
It's pretty miraculous that he's able to come in anyway, because to participate remotely in a meeting, but the sound is a little bit challenging. Bob, we will have more conversation with you. I think the important contribution that you've just made in that comment has to do with looking at a matrix, which gets us away from needing to find one magic number and looks at a variety of measures. I think I also heard you talk about the importance of 5-day-a-week in-person school. So I'll say that to get everybody, in case not everybody was able to hear you.
I'll provide Jamie some feedback offline as to criteria that I would look at. It's probably a little bit easier to convey that via phone or email to Jamie than tonight publicly.
Perfect. So Bob just said that he was going to convey some other ideas, some other criteria that could potentially be on the matrix to Jamie that we could all consider at a later point.
I'll say one more thing that, we've had this conversation at the place I work with, I think from the conversations I've had with people in the community who have kids at different levels, one of the things that's going to factor into my decision is the fact that, to Alan's point, when the vaccine was initially being rolled out, and there were people who may have said, in the normal course, I don't want to do it for myself, but to avoid the possibility of having to wear the mask, or to help further that along, I did it, and to take that away now is something that would be difficult for me, and so that's another consideration that would be hard and would lead me to potentially want to break out the group that does have that ability to say, I've made the choice to either do this or not. And to me, you're at that point, you're assuming more of the risk personally than the people who shared stories about their kids that are under the age of 12 and don't have that choice yet. So, I don't know if there's a middle ground when the time comes to vote on this, but something that would be a consideration of that, maybe finding a middle ground between the options that are presented, 1 and 3, is option 2 does allow for the people that made that choice and felt that it was a responsible choice, even if it's something they didn't necessarily want to do, because it wouldn't exclude them as a close contact, and it would make it more likely that masks weren't worn. I mean, that was something I dealt with in a business setting, but also have heard that same sentiment in regard to 15-year-old kids or high school kids that made that choice when they had the option. I think initially it was 16 and over, and then went down to 12. So again, I feel like there's more choice to be had for that age group. I don't necessarily like breaking them out into 2, but I think that's an important point, at least in the consideration that I've had up until now in trying to weigh that.
It is super disappointing to have to be reconsidering these things. I actually, frankly, thought last year was going to be the really hard year. And I can hear what you're saying, Todd. I think that before we would make a decision on that basis, we'd probably have to get more clarity about the potential for vaccinated people to be spreaders that would then impact the young ones who haven't been able to be in a double way. So
Yeah, and
we have to think about that.
The tough thing for somebody like me is to know, is the spread the issue, or is the severity of it the issue, and how to weigh that out too, because that's a difficult piece of it. I mean, a lot of people getting colds, but there's not a terrible consequence to something like that, and the unknown of it is a little daunting. But from all indications of things that I hear up to this point, beyond kids not being very seriously at risk is that people who have chosen to take a vaccine are also seeing much less in terms of the severity compared to where we were the first time around with some of this. So the case numbers are important to look at, but also the severity of it and what people's personal choice might mean in that regard. I feel better about it for the people who have that choice, and I do feel differently about it for those that probably don't at this point. So.
Again, one other observation. I think that, I can't speak for the board, but it appears to me that one of the things the board may agree on already is that we want the students back in school this fall, right? We're not considering hybrid again. We're not considering any of those more draconian mitigation strategies. We're not talking about any of that. So we're really talking about how we get them back in the classroom, face-to-face instructional learning with instructors in front of the class, and how we do that. And masks is one thing we're going to be talking about, but there may be some other things we're talking about, right?
I agree, Ellen. I'll add one point to that, and that would be to say for the families that are choosing in person. Because
Yes.
we will be keeping the virtual option because that's the most appropriate for some kids.
Good point. Yeah.
I think in my mind, when I think about top priority obviously is allowing the opportunity for all kids who choose to come 5 days a week. We want all those kids in person 5 days a week, whoever chooses that option versus the virtual school. The next in my mind would be the contact tracing. We don't want kids being pushed out of school because they've been close contacted. And then the third would be the masking. Those are kind of, in my mind, the priorities.
And how they relate to each other is the complicated thing.
Correct.
Because it could be that we have to go to masks in order to achieve the top and not have the.
Although
close
it's interesting
contact
because
now.
last year we did mask throughout the entirety of the pandemic, and yet we still had to, our numbers did hit a level at certain points in the year where we did have to shut down and swap the grades 7 through 12 to virtual or distance learning. So even with the mitigation efforts, they're not foolproof, right? And,
Oh, no.
and certainly we still,
I think of it as like sunscreen. It's not going to prevent me from getting sunburn out there, but it's going to allow me to be out there longer. But part of the issue about the close contacts is now the guidelines have changed somewhat.
Yeah,
So
for us too, this is good,
adjustment.
this is good conversation because we, again, purposefully felt like we needed to have the most conversation regarding the masking topic, but to be clear, the board already put in place and we are not considering any revision to. This summer, we used the 3-foot rule for close contact tracing, not 6. And the experts would say, we're fine with you using a 3-foot rule as long as everybody is wearing a mask. Otherwise, you should still be using the old 6-foot rule. We're not even talking about that. We're going to be presenting next week to you that we're going to follow a 3-foot rule, whether you wear a mask, not wear a mask, whatever that decision is, wherever the board lines up on that. Close contact tracing should, you would think mathematically, if we're at 3 feet instead of 6, you would hope those numbers would go down. Now we have a variant that might be more transmittable, so we don't know. But I just wanted to really clarify, we're not talking about fall sports either, are we? We're not even having that conversation. The recommendation is we're going to move ahead with that. We're not talking about band and chorus. We're going to sing songs and play music.
And game club and chess club and all of those.
All kinds of
things,
clubs and
because
organizations.
We know that those things are really important for our
Top
kids'
priority
well-being.
is in-school learning opportunities for those that are comfortable with that. And for those that are not, we have the virtual option. Hottest topic of all is clearly the mask debate.
I think a close second, though, is that close quarantine.
True.
And they
I may be
sometimes they're hard to
presumptuous.
parse.
The focus has been on this mask topic more so than the close contact tracing.
Jamie, I think in your presentation earlier, you made mention of equity and the ability to deliver instruction to as many kids as possible and to make sure that we are providing what all students need. And so in thinking about the masking, I do just want to share something that I've really been thinking a lot about. I've talked to some classroom teachers from 4K up to, I believe, second grade. I've heard from some parents, and there are a handful of student groups that I think we at least need to have the conversation about how masking could impact their ability to engage in learning. The first group in my mind is the K2 students where we know early literacy is so important. Kids are not reading at grade level by second grade. Their trajectory is way off in the future. And I know, as I was a classroom teacher, kindergarten and first grade, and in talking to other teachers of those primary grades, phonemic awareness, phonics instruction, segmenting words and isolating sounds, those are all very, very difficult in those primary classrooms when you have a mask on the teacher and a mask on the student. And I think that's important to consider the potential ramifications. I'm not saying those outweigh the potential medical risk. I'm just saying we have to at least acknowledge the potential of that impact on our students in the years that lie ahead. The other group of students that I'm thinking about are Title I students who are already facing some learning struggles. They've likely incurred some learning loss over this past year. Those are our kiddos that are really, really needing those intense academic interventions. A lot of times they're working one-on-one with an instructor or a teacher. And there's a barrier there, and it's difficult to learn with those masks on, particularly if you're focusing on literacy. I also have learned since joining the board that we have a growing number of English language learners in our district, and I cannot imagine how much more difficult it would be for students to enter our buildings not having English as their primary language and be trying to engage with their peers, with their teachers, when you can't see the mouth of the person you're talking to or hear properly the language that's being spoken. And then also our special education kiddos, I think it's important that we give voice to those students and their parents. For those students who are receiving special education services, we have to acknowledge that there are students who are going to feel distress or anxiety or discomfort when wearing a mask, and then also students receiving speech and language services. That's basically what they're working on is communication and articulation, and that's challenging when faces are covered. And then last, I mentioned this earlier, but I just want to make this point again. Young children are relying on facial recognition for all kinds of early childhood development and just basic social competence. And I know one of our district goals is to provide that social and emotional support for our staff and students. And I think, again, I'm not making a proclamation that health is, the health side of the coin is more important than the social emotional side, but we just have to acknowledge that there are things that our students are not going to receive in their experience at school if their faces are covered and their teachers' faces are covered.
Very, very important points.
Just to pick up on that, what it comes down to, we had this conversation very intensely last summer, and some of the stuff you're talking about is exactly why I wouldn't have supported, in fact, talked against going totally online. That was one of our options out there, going totally online. But what we're faced with, once again, because you've sort of laid out part of this, is if there's only two choices here, which are we going to give priority to, social and emotional health or physical health? And we've literally, the dichotomy we have here is we've pitted one against the other, and at what point do we say that social and emotional health is more important than physical health, or physical health is more important than social and emotional health? Can we kind of figure out a middle way? So I don't disagree with any of those kinds of things. I think our teachers work best when they're there face-to-face with our students in live time, especially young learners. Does that put them at risk for their physical health? That's what we're trying to all grapple with. That's what everybody in the country is trying to grapple with right now, and why we're trying to figure out a path here. So does doing all of that put them at risk in another way, or does doing some of the other mitigation things put their social, emotional health at risk. It's our
And of
dilemma.
course, it is a false dichotomy, isn't it? To be thinking that we can even separate these things
Yes,
out.
yes,
I
exactly.
mean, we're all integrated humans.
The other thing too is that the answer to that question varies kid by kid based on some of the experiences. You know, some kids, the physical safety is far beyond the facial expressions and those kind of things due to their circumstance. And in other cases, it's the exact opposite end of that spectrum. So I think everybody knows that, but it just maybe illustrates what you said earlier, that we don't have the luxury of dealing in absolutes the way that some of the stories share, unfortunately.
Yeah, I agree, John.
I was going to ask, is there anything that the administration is looking for beyond the conversation tonight, or do we just take that and then wait till next week with a recommendation?
No, again, the purpose of the meeting tonight, we intentionally wanted the public to know that we're listening and to not only public opinion, but we're also listening to quote unquote the experts. We want to be transparent and allow community members to speak with the board, for community members to hear where the board is currently at, give the board a week, come back next Monday. We need to let people know what the plan is. Our staff needs to know, parents, students, and so on. And so we're at the point where we just wanted to talk about all these issues and see if there were some common themes, some new ideas that came forth. Plant some ideas inside the board that maybe you have not heard from other parents until tonight. And part of it, I think, is an effort to make a public statement and show how we have civil conversation and civil debate over a pretty challenging topic. And so I appreciate everybody's approach in voicing your opinions tonight. Might not be a coincidence that we have our character posters on the stage tonight. I'm not sure how they ended up here, but rather symbolic considering what we're looking for. Got to support each other with this. I'm very convinced personally that I'm proud of our administrative team, I'm proud of this board, and I'm proud of our staff. When you take the efforts that we did last year in conjunction with what Scott Simpson and the City Hall did, what Connie Foster and the UWRF did to mitigate the further spread, big entities, lots of people in those places, city level, university level, school level, employees, people being served, actions of local businesses complying with some of these orders. To your earlier question, the governor at one point had issued a mask order. Supreme Court said, not so fast, you don't have that authority. We ended up staying the course, even though the Supreme Court said, so initially we were following a governor's order. We ended up staying the course with it, is how that went down. At any rate, everybody has their story, everybody has their version of the truth and what should be done, and appreciate again everybody being here tonight to help the board contemplate, and myself as well, some more challenging decisions that lie ahead for next Monday night.
You know, it strikes me that often we are in a very difficult position having to choose between two good options. And that's hard enough, let alone when we're in a position of having to make decisions between options that we really don't like. But that's where we're at, and thank you, everybody, for being good partners in all this. So, do you want to say
Sure, one more thing.
Yeah.
So I shared some thoughts earlier, in regard to our stand, that it's not definite. It wouldn't be definite 2 weeks from now if we voted today. Honestly, I'll be surprised if we make a decision that, for one way or the other, goes through the end of this coming school year. So the one thing I'm definitely not in favor of is trying to make a recommendation that's going to draw a line between masks for vaccinated, unvaccinated, and trying to discern that and enforce it. I have no interest in doing that kind of thing. So the one kind of absolute that I'm, for me, that I'd like to see with the recommendation is the options that are laid out, but not trying to distinguish anything between between people who are vaccinated or not. To me, it's optional or it's mandatory. And whether we differentiate the grade level is great, but I'm not in the business of trying to ask each individual person when they walk into a building, and I just have no interest in trying to police that, or not myself, I guess, but whoever would be charged with that, I have no interest in it.
I agree. And I think that, so we've had some agreement about that. We've also talked about this idea of a matrix with some criteria, which I think connects to the earlier point that you made, Todd, about when we do vote, we're not making a decision for the entire year. I think that would be very unwise. Things are changing so quickly. Plus, we like to be able to respond to what's going on in our community at the time. That doesn't mean being reckless or changing more than is necessary, but we want to be responsible. So presently, we have a lot of thinking to do. Jamie has some work to do. Thank you, everybody. And we'll be back here again. The meeting is adjourned.